I want to personally thank you for your leadership when you were a colleague here and all of the advice and support you gave me as a new member coming to work for the people of America. So thank you, and I know that your staff are incredibly happy to work with you. Wanted to ask you some questions that were specifically related to Medicaid. What is the level of federal Medicaid funding for the territories? And does the president's budget include throughout this budget window? Are you aware of what that would be?
I can tell you because whether I was as a colleague or now as a Secretary of Health and Human Services, we do not adequately provide resources to the territories, and the President has made it one of his goals to try to change that. So working with Congress, because we do need statutory authority, we hope to be able to do that.
And that statutory authority is the request that you have for Congress to do that.
We have requested, and we've supported eliminating Medicaid funding caps for the territories.
Thank you. That, of course, would be incredibly important. The Congress has, since 2017, after the hurricanes hit, and I know Chairman Pallone as well has worked tirelessly to bring this up. In the Virgin Islands alone, just leveling the FMAP number and making it more equitable with the states based on population has allowed us in the Virgin Islands to increase the amount of individuals by over 20,000. That has really been a game changer for our hospitals and for others. So I thank you for that and your desire to support us. HHS funds the Welfare Rules Database maintained at the Urban Institute to capture the rules regarding determining eligibility and benefits for TANF assistance. It does so for 50 states in the District of Columbia, but doesn't include the Virgin Islands, Puerto Rico, and Guam. Additionally, supplemental security income is not available to the Virgin Islands, Puerto Rico, and Guam, and these jurisdictions operate public assistance programs instead for the populations aided by SSI elsewhere. Has HHS considered expanding the welfare rules database to those other territories so that eligibility and benefits rules are available for those jurisdictions as well as the 50 states in the District of Columbia?
You're pointing out, Congresswoman, longstanding disparities that exist for the territories. And you have my commitment to make sure we can try to work towards eliminating those. We probably need your help in changing some of the statutory provisions that make it difficult for us to get there. But we are actually committed to working with you to try to get there.
Thank you. On July 26, 2021, I sent a letter on behalf of the Congressional Black Caucus as co-led with my colleague, Congresswoman Robin Kelly, who's been tireless in this as the chair of the CBC Health Brain Trust. It was signed by 38 members of our caucus. The letter specifically requested that your department would work to ensure meaningful access to the potentially curative sickle cell disease therapies on day one of their approval by the FDA. We received a response from you, thank you, on November 1st of 2021. I'd like to ask where the department, with respect to convening a multi-stakeholder dialogue about identifying and providing solutions to help remove barriers that stand between sickle cell patients and those potentially curative therapies.
Congresswoman, we are doing more than had been done previously, but let me suggest to you, in fact, let me make the invitation right now. This is one of those areas where I've spoken to our team, and we've spoken to a lot of the outside advocates on this. I think under this administration, we could move to actually help all Americans who suffer from sickle cells get past the pain that they constantly suffer. We have learned so much, and with the technology that we have today, there is no reason why we couldn't target sickle cell. And so having done a meeting at NIH on this particular issue, I think that we are prepared to tell you that if you're interested, we'd like to join with you, because if we get the resources, we could really blow this one out of the water.
Well, thank you for that. This has been a disease that has really just been pain managed by government as well as our researchers. And we recognize now through some incredible work that this may be a disease that we can cure. It would be just phenomenally changing. I've lost a number of family members to the disease, and I think it's something that we can get through.
And what's really traumatic is that oftentimes people come into a caregiver and saying they're in such pain, but they're not believed. People
Yeah.
don't, and it's not until they find out that they have sickle cell that they realize, okay, you must be undergoing severe pain. But it's the difficulty of people presenting with pain and not being believed. That's what's really hard to believe.
Thank you so much, and I yield back.
Gentlewoman's time has expired. I now recognize the gentleman from Pennsylvania, Mr. Smucker, for 5 minutes.
Thank you, Mr. Chairman. Good to see you, Secretary. I have two issues